So, quick introduction. I'm Mohit. I'm a principal researcher at Microsoft Research Lab in Bangalore, in India. So, I'm fairly close to ISC uh, physically. And I'll be talking about two of my broad projects. One is on doctor in the loop, basically expert in the loop chatbots, and the other is on low cost diagnostics. And I think there is some, I think, flavor of that work already talked about in some of the previous talks. So, it would be, I think, complementary. Okay. So I think, as we all know, patients who are undergoing critical treatment, let's say surgery or cancer therapy, requires timely, trustworthy, and precise medical information. However, doctors are always overworked. They have a lot of patients. For example, in India, there are only 7 doctors for every 10,000 patient, and hence they end up spending very less time per patient, which also impacts their information sharing in a negative manner. Okay. From a doctor's perspective, they get asked similar questions across patients. For example, anyone going through a surgery might ask like when they can start eating their favorite biryani after the surgery, or when they can start watching TV, or when they can wash their hair. With the emergence of large language models, we thought that it will help to make healthcare more equitable, more universal. However, LLMs hallucinate and they make mistakes. Also, OpenAI usage policy clearly restricts usage of LLMs for medical and financial and legal services. Okay, so our broader aim was that can doctors, because they are the experts and they can actually help improve the AI system. And in return, can the AI system help the doctors to attend or to care for more patients? So with that, we made expert in the loop chatbots. So there are three ongoing deployments of this bot. One is for patients who are undergoing cataract surgery at the Sankarai Hospital. And second is for patients who are undergoing cancer treatment at Kasturba Medical College. And the third is for our community health workers, which we call as Asha bot. Okay. So I'll just briefly tell you about the how the system works. And then there are these three use cases which are very similar to each other. Okay. So let's say, I think, okay, quick thing. The whole system works on WhatsApp. So these are the three major things that we made sure of, that the system is highly accurate. So every answer is verified by a medical professional, and it is easy to use. So it does work on WhatsApp, supports multiple languages, multiple modalities. The third is that the workload on the expert, which is the doctors and the nurses and the ANMs, is minimal. Okay. So, so first of all, so let's say a patient who is undergoing either a head and neck cancer treatment, or even a cataract surgery, they ask this question: when can I wash my hair after the surgery? They could have asked this question in Hindi by sending a voice message as well. Uh, then the then we have a curated knowledge base which has been created by the doctors of that hospital, and a simple RAG-based system with some, I would say, tricks that we have learned over a period of time. We generate this answer that you can wash your hair 3 days after the surgery, but we send that with a question mark saying that this is an unverified answer. The doctor at the same time receives the question answer pair along with the patient demography with a simple question: was the bot's answer correct and complete? If the doctor says yes here, the patient receives a green tick mark here saying that it is a verified answer now. If the doctor say no, then in that case we inform the patient with a cross mark saying that this answer is invalid, and wait for a correction while we ask the doctor to provide a feedback on this answer. Okay, so this is the most crucial step. So the doctor doesn't have to edit the answer or doesn't have to write a new answer. The doctor can just provide a feedback. They could have just written 2 weeks, like two space WKS, free form manner, incomplete, incorrect grammatically. They can send that message to the bot, and the bot makes sense of that message and frame it as a formal message that better to avoid washing your hair for 2 weeks after the surgery, and send that with a green tick and the verified by a doctor message. Okay, so this completes the loop. Now this new knowledge is also added to the knowledge base to make sure that the next time somebody asks this question, they get a 2 week response and not a 3 day response. So this is broadly the system. Now, because the system has been running for more than a year, we have a big Q&A already, verified Q&A from the doctors. So let's say now a new patient asks this question: surgery is done, when can I shampoo? So we give them this response. A similar question was answered previously: when can I wash? Better to avoid washing your hair for 2 weeks. Does this answer your question? So if the patient says yes to it, then we close the loop here. If the patient say no, then we fall back on the bigger loop. Okay. Uh, Now just quickly showing you the deployment. So this system is running for cataract surgery at Sankara and in 3 centers: Bangalore, Hyderabad, Jaipur. It supports 8 languages. These are slightly outdated number, but you can see that almost like more than 10,000 questions has been asked to the bot, and most of the time the doctor says yes, the answer is correct and complete. Nowadays, the almost like for 5% of the question it goes to a doctor, 95% is just handled by the previous, like the pre-verified answers. The whole system or the framework here is called as build your own expert bot. We have open sourced it under the MIT license. Anybody can build a expert in the loop chatbot very quickly. Similar deployment for cancer at OncoBot, and similarly, I was telling you for community health worker as AshaBot. This is like very old numbers. Now it is like more than 50,000 questions have been asked to the system, and more than 10,000 Asha workers are currently using it. It is in Rajasthan and Maharashtra. The deployment is with the NGO called as Khushi Baby. Okay. Uh, I think that's pretty much it. Yeah, if you need to know more, yeah, please reach out to me. Or there are like a couple of papers that we have written both on AshaBot and CataractBot. OncoBot is still a work in progress, so we have not written much about it as of now. Okay. Now moving on to the other part, which is basically on the low cost diagnostics. So I think yeah, we all know the motivations. Our aim was that we wanted to develop low-cost smartphone-based diagnostic tools with AI assistant embedded in them to enable community health workers, teacher, even like Swiggy and Zomato delivery personnel to perform preliminary screening of certain diseases with minimal amount of training. Okay. So, and then to achieve that aim, we worked on a bunch of projects here. From a bunch of them are in keratoconus because I have a close collaboration with Sankrai Hospital, but there are also on lung disease on the height of a below 5-year-old kid and even blood pressure monitoring. Uh, Today, I'll just quickly touch upon the first project because this is the most mature one, which is for diagnosing keratoconus using a smartphone. Okay, so let me just jump into that. So the keratoconus is a disease wherein your cornea becomes distorted instead of the this dome shape. It actually becomes more of a conical shape, and it is the leading cause of blindness among the teenagers in India. Okay, so diabetic retinopathy mainly impact the older population, but among teenagers, keratoconus is the leading one. And so early diagnosis is the key. However, the device that we have here, I'll just skip these, is a corneal topographer, and this is a $20,000 device. So it's very hard to have it in the primary healthcare center. Okay. So what we did was that we actually built this low-cost portable topographer, which captures the Meyer image, which is basically a reflection of these circular concentric rings on the eye, and output the curvature heat map, very similar to what a corneal topographer does. Okay. And this is completely done in-house at MSR. And this is a slightly old project. We worked on it from 2019 to 2024, 25. Like very recently, we stopped working on it. I'll tell you the reason why. So the idea was that like, yeah, we have this 3D printed attachment, then we designed and printed, and that can be connected to any smartphone camera. And this is how it looks like. Like there's a very early prototype, but you can see there is a ring of LED lights which is here, and this is the Placido head, which is basically concentric rings, and we use a baking paper as a diffuser here. Okay, and then this has this twist kind of I would say setup here that you put inside it, like, and then twist to lock it. And now when you connect it with the smartphone, so we don't have any charging discharging circuit here. The LED directly gets powered by the phone. From inside, it looks like this. So just to tell you, it looks very similar to the medical device that I showed you before from the inside, like this kind of a device from inside. Okay, so there's the resemblance. So let me move on. And in order to make sure that the image quality is very high, because we wanted to have a clear, I would say, alignment between the principal and the reference axis, one of the camera, one of the eye, we had this AI algorithm embedded in it so that it results in auto capture. Okay. So whenever there is a alignment between the eye and the smartphone camera, it captures three images, and you can see this here automatically. You'll see a few images getting captured. And then we get like this high quality image. And then we have image processing pipeline to convert these Meyer images into the heat map and the SIMK1, SIMK2 value. We like this is the, I think, one of my more I think more complex projects, wherein like then we evaluated it at the hospital on certain number of eyes, got really good result both qualitatively and quantitatively. We got like some 94% sensitivity and 100% specificity. And then I think interesting thing happened was that like we got a lot of interest from a lot of universities, a lot of hospitals and research organizations like LVPI, Narayana Nethralaya. and even some device manufacturer like Remedio and Glaukos. Glaukos is a US-based device manufacturer for keratoconus treatment, and Remedio is a Bangalore-based one. Like moving forward, as I was telling you, we open source all our technology. So this is all completely MIT license open source on GitHub, including the hardware and the software. And then Remedio actually ended up in the last 2 years. They improved the system and they made a medical device using our approach. And this year they have released it, and this is called as InstaKC. Okay, so so yes, I think you get the idea here. Yeah, basically. So this is the Remedio, and I think this is a $2,000 device. So there is a price cut of almost 10x on these devices, but this is a early stage screening device. Okay, uh, and that's pretty much it. I'll stop there. Okay, thank you.